Hello everyone, my name is Sam. I am a GP. Today I will be presenting on cancer screening again. The specific topic for today will be on colorectal cancer screening, part 1. As usual, before I begin my presentation, I just want to show my disclaimer. First, I will begin with an introduction. In Australia, there are about 16,000 new cases of bowel cancer each year. This accounts for about 11% of all new cancer diagnoses. The good news is that if diagnosed and treated early, bowel cancer is 90% curable if found at an early stage. Next, we will discuss what is screening. Screening test refers to testing an individual who has no sign or symptoms of a disease in order to detect a disease early, so that the disease can be treated early before it does any harm to the patient. The benefit of early testing and detection has to outweigh any potential harm. Now we will move on to colorectal cancer screening. In colorectal screening, with regard to what screening test to use, when to screen, and how often to screen, is usually based on the risk profile of the individual patient. The risk profile of the individual patient can be classified as high risk, medium risk, or low or average risk. In this presentation, we will be talking about colorectal cancer screening in average risk patient plus those with only very mild increased risk patient. We will be discussing more about moderately increased risk patient or patient at higher risk in subsequent presentations in the future. So if a patient is of average or low risk and he or she has no symptoms and no personal history of bowel cancer, colorectal adenomas, or inflammatory bowel disease, and then the recommendation is that the patient undergoes what we call the Fobt, or fecal occult blood testing, every year from the age of 50 onward. A person is considered average risk if he or she has no symptom, has no personal history of bowel cancer, colorectal cancer, or inflammatory bowel disease, and has no first degree or second degree relative with colorectal cancer. A person is considered at mild increased risk if he or she has either one relative first degree relative with colorectal cancer diagnosed after the age of 55, or one second degree relative diagnosed with colorectal cancer after the age of 55. So next we will discuss what is an Fobt. Fobt stands for a fecal occult blood testing. It is a stool test that looks for early signs of bowel cancer. Essentially, it looks for hidden or tiny amounts of blood in the bowel motions that cannot be seen by the naked eye. Blood is usually caused by something else, such as a hemorrhoid or menstrual blood in women. However, it may also be a sign of early bowel cancer or polyp. Study shows that 2-yearly fecal occult blood testing can reduce colorectal cancer death or mortality by about 16%. Therefore, Fobt is recommended for asymptomatic population from the age of 50 onward and be done every 2 years if it remains negative until the age of 75 with repeated negative findings. The aim is to find or diagnose early changes in the bowel lining, which include the following benign growth. This would include hyperproliferation here, small adenoma or large adenoma, or severe dysplasia or precancerous. These are still all considered benign, and hopefully these can be picked up and removed before they can turn cancerous. Next, we will discuss briefly about the FOBT collection procedure. In Australia, at the age of 50, many people would receive FOBT home collection kit, which include 2 collecting tube, which has got 2 collecting sticks within them. After being collected, the patient is recommended to write the name on the tube and then label the sample as sample 1 and sample 2. The patient also receives something in the package called a toilet liner, which you line, as the name implies, you line on the toilet bowl, such as this. And then you open the bowel and collect your stool on top of the toilet liner. Next, you will use the collecting stick from the collecting tube to collect some stool from the stool sample that you have done on top of the toilet liner. After collecting some stool onto the collecting stick, you then put the collecting stick back into the collecting tube. And the sample is then put into this zip bag, which also comes with the FOBT testing kit as well. The first sample is then put into the fridge. On the second day, the procedure is repeated. The second sample is then collected. The 2 samples are then posted off in the postage or poster envelope that comes with the FOBT testing kit, and then is sent off for testing. Now that we have discussed about FOBT for low-risk patients, we will quickly discuss about colonoscopy. Generally, colonoscopy is not recommended as a screening test for people at average risk of colorectal cancer, because colonoscopy has got indirect and direct harms, including rarely death from the procedure. Harms can be caused by the bowel clean-out process prior to the procedure, which can lead to dehydration or electrolyte imbalances. Harm can also be caused by the sedation used during the procedure itself. This would include cardiovascular events, especially in high-risk population. Or harm can be from the procedure itself, such as infection, colonic perforation, or bleeding. If you have any more questions, please feel free to speak to your healthcare professional for further advice. Thank you very much for watching my YouTube video. If you like my presentation, please kindly subscribe and share. Stay alive, stay safe, and stay healthy. Many thanks. Have a nice day. Take care. Bye-bye.